Welcome, and thank you for joining us for this Flinders University Meet the Mind session today on childhood glaucoma, and particularly developing a patient-reported outcome measure for childhood glaucoma. My name's Alan Sicolo. I'm from the Meet the Minds team here at Flinders University, and I'm really excited to host today's event as we explore the lack of understanding about how children with glaucoma and their families cope with the devastating eye condition, a critical issue that affects approximately 5% of children with vision impairment. To begin with, I'd like to acknowledge that we're hosting this forum on the traditional lands of the Kaurna people, and that we pay our respects to their elders past, present and emerging. We also acknowledge and convey our deep appreciation to the elders of all the nations upon which Flinders operates. This event is delivered as part of our Meet the Minds lunchtime lecture series, where you get to meet some of Flinders University's most engaging minds as they bring you their latest research from a diverse range of fields. And today we're extremely fortunate to be hearing from Dr Mallika Prem Senthil, a lecturer in ophthalmology here at the college, here at Flinders University in the College of Nursing and Health Sciences. Mallika is an ophthalmologist with extensive clinical research teaching experience in both tertiary education and the healthcare sector. Prior to obtaining her PhD at Flinders, she worked as a senior lecturer as well as a consultant ophthalmologist in Malaysia and India. As always, we are really keen to make this an interactive session with live Q&As. That's your chance to participate in the discussion and pose questions to the speakers in real time. We do, however, ask that everybody treats this forum as a place of respectful engagement, where people are treated with dignity and where differing views are tolerated. We are ready to start receiving questions now. Please use the chat functionality within the Teams platform. And without any further ado, it's now my pleasure to invite Dr. Mallika Prem Senthil. Over to you, Mallika. Thank you.
Thanks for the kind introduction, and I would like to thank Flinders University and the Senthil team for giving me this opportunity to talk about my research and this lecture series. So I'm an early career researcher. I joined Flinders in 2018, and yeah, I'll be talking about one of the research which I'm currently involved with. It's developing patient-reported outcome measures for childhood glaucoma. And as you see, there's a quote here from a patient who was diagnosed with congenital glaucoma at the age of 1 year. So what is glaucoma? Glaucoma is an ocular condition where there's a damage to the optic nerve due to raised intraocular pressure. And childhood glaucoma is defined as glaucoma occurring in individuals less than 18 years of age. It's a very devastating condition, both for the individuals as well as for the families. And early diagnosis is very crucial in preventing an irreversible loss of vision in children. So management of childhood glaucoma can be difficult and visual outcomes can be poor. So glaucoma can pose potentially devastating emotional, social and physical consequences, but clearly there's a lack of understanding of about how the affected individuals and their caregivers cope with congenital glaucoma. And the main reason for this is because we don't have a very disease-specific patient-reported outcome measure for childhood glaucoma. So why does this issue exist? Currently existing patient-reported outcome measures are not specific to congenital glaucoma, which means they don't have questions or items relevant to the disease. And they lack sensitivity in capturing issues such as the impact of surgery or medications on quality of life. So there's definitely a need for developing a reliable and valid patient-reported outcome measures for childhood glaucoma that is easy to administer and also sensitive enough to detect meaningful function changes in advanced disease. So what is the impact of the disease? As I told you, it's a potentially blinding condition that is responsible for approximately 5% of childhood blindness worldwide. And increased intraocular pressure can cause both structural and functional changes to the eye. And childhood glaucoma, as you know, it occurs much more earlier compared to the adult counterpart, which happens after 50 years. So definitely it has a much worse prognosis compared to the adult glaucoma. And prognosis, again, depends on early accurate diagnosis and surgical intervention to control the intraocular pressure. Management is complex and challenging, and children often require multiple general anesthetic examination techniques to measure intraocular pressure as well as to look into the back of the eye. And even after surgeries, children might have to be on long-term medications, which can be associated with side effects. So yes, affected children and caregivers are likely to experience stress and anxiety, both at the time of diagnosis as well as during management. And not only that, childhood glaucoma can significantly affect their family. Parents may decide not to have further children because of fear of passing on the disease to their kids, and can go for other options such as adopting a child or going for an in vitro fertilization. So what will happen if this issue is not addressed? Because we don't have a disease-specific patient-reported outcome measure for childhood glaucoma, it makes it difficult to accurately assess the impact of childhood glaucoma on quality of life. And not only that, clinicians and researchers will not be able to monitor the treatment outcomes, and it makes it difficult to identify patients who are at risk or patients who need further help or any specialist intervention. And not only that, as new treatment modalities are emerging for childhood glaucoma, without a specific patient-reported outcome measures, it makes it difficult to compare the effect of different treatment modalities from patient perspective. So how did I end up here? So I came to Flinders in 2014, and before that I worked as an academic and as a clinician in India and Malaysia for almost 10 years. While being an academic and clinician, I was really interested in research, and the first thing that you do when you are interested in research is start writing papers. So I managed to publish over 30 papers, and then I knew that if I have to progress further in my research career, I have to do a PhD. That's when I just applied for a PhD at Flinders in 2013, and I was offered a PhD in 2014. And luckily, I managed to finish my PhD in 3 years' time, and I was fortunate enough to get an academic position in the same discipline where I did my PhD. So what inspired me to investigate this issue? Like I was a clinician for almost 15 years, and most of the assessment outcomes as a clinician are made from the clinician perspective and not from the patient perspective. And slowly we are moving from clinician perspective to patient perspective. So I've been always interested to know what is the patient perspective of a disease. And this interest again increased during my doctoral study, which was again a research which was more or less similar to this, what I'm doing now. So developing a patient-reported outcome for retinal disease, where I managed to interview about 80% patients with different retinal disease to know how different retinal disease affects their quality of life. And the information that I got was really amazing, which changed my perception. So that increased my interest in quality of life and patient-reported outcomes. So my current research interest is also like incorporating patient-reported outcome measures into the routine clinical practice. And about this study is like why I became interested in this study is because this, again, the impact of childhood glaucoma on quality of life is poorly understood, and the paucity of the data is because of a lack of a validated tool. So that's one of the reasons I got involved in this study. So this issue, why is this issue important to me? This study will provide me opportunities to network with established researchers in the field of study, and then expand the research and impact of my research, which will then enable me to further advance in my research career. So what have we found so far? Now, developing a quality of life instrument or a patient-reported outcome measure is similar to developing an instrument. It involves a multi-stage process. So our study again involves 3 stages. The first stage is identifying the items for the questionnaire. So items are usually identified from the literature as well as from interviews and focus groups with patients with childhood glaucoma. And once I have identified the issue, the items and the issues, that will be formatted into a pilot questionnaire. And then that will be the stage 2, where the pilot questionnaire will be tested on patients with childhood glaucoma, and to see how the questions in the questionnaire are relevant to the population. And then After pilot testing, we assess the measurement properties of the questionnaire to see if it's fitting well with the research, and then we finalize the final questionnaire. And once that is done, the third stage is testing the validity and reliability of the instrument. So we test this patient-reported outcome against another traditional questionnaire to see its validity, and also we do testing and retesting to make sure the questionnaire is reliable. That is, whether it's consistently measuring the same thing what it's supposed to measure. So far, I mean, we started the study last year, and we have so far completed 50 semi-structured interviews with patients with childhood glaucoma, and our preliminary results shows that congenital glaucoma has a substantial negative impact on the quality of life of the affected children. So patients with congenital glaucoma, they have difficulty performing day-to-day activities such as reading, driving, playing sports and doing household chores, and then they experience a lot of negative emotional reactions, and they experience a lot of inconvenience due to frequent hospital visits and frequent installation of medications. And then it affects their career, it affects their job, and it also affects their social life, and again it impacts their family. So we have extracted all those quality of life issues and formatted that into a questionnaire, and so we'll be starting soon our pilot testing. Next step of my research, so the pilot questionnaire will be tested on over 200 patients with childhood glaucoma, and usually, I mean, it will be interviewer administered either face-to-face or over the telephone, but then if COVID restrictions are in place, then we might administer the questionnaire online. So once we finish the pilot testing, the measurement properties of the questionnaire will be assessed using a modern technique called a rash analysis. What will this research achieve in future to help solve this issue? Well, we are we'll be the first researchers to develop a very disease-specific patient-reported outcome for childhood glaucoma, and so this will be specific for Australian population, but then people from other countries can also use this instrument and can validate in their population. It can also be translated in other languages, and it can use for a wider community. So definitely it will have an international reach. And as you all know that management of childhood glaucoma involves a multidisciplinary approach. It involves optometrists, ophthalmologists, pediatricians, general practitioners, nurses, and social workers. So from this research, we will get very vital information about how childhood glaucoma affects the individual, so which will then help us to improve the service delivery to affected individuals worldwide. So definitely this study will benefit not only the child, but then their family and their treatment decision. Would like to acknowledge and thank my research team. So Flinders Optometry is collaborating with Department of Ophthalmology at Flinders Medical Center and other centers in Australia to do this research. So I would like to thank all of them. And currently we are having one of PhD student who's looking into this project, and we are very excited to commence the phase 2 of the study. Thank you.
Thank you very much, Mallika. That was a really wonderful and interesting presentation, starting off with the devastating eye condition of that affects children and their families, and then outlining the important research that you and the team are leading to improve outcomes both in Australia and potentially with international impact, which is wonderful. And it was great to hear just before we did go live, you telling me that you got additional grant funding approved just yesterday. So congratulations on that. That's wonderful. We are starting to get a few questions from the audience, and I'd like to encourage some more. We'll try to get to as many as possible, but please, we may not get to all of them just due to time. The first question is from Asha, and she's asking, did you interview children or adults in stage 1?
All right. Okay. So, we are actually developing patient-reported outcomes for 3 groups. One for children with childhood glaucoma, and then adults with childhood glaucoma, and also for caregivers. So, but this presentation is entirely focused on just adults. So, we have mostly focused on adults, and we are also starting to interview kids and the caregivers. So we have managed to interview only few kids and caregivers, but then majority of these patients were adults with childhood glaucoma.
Mm. Well, yeah, I would have thought that would be quite difficult as well. What age can you start interviewing kids?
Yeah, it's like literature says that about 8 years. I mean, anything less than 5 years tend to be a little bit less
Sure.
sensitive, or it becomes less. I mean, it's difficult. So it's like we are planning to develop childhood glaucoma. We are planning to recruit kids between 8 to 12 years, and then again 13 to 18 years, and then adults with about 18 years. Yeah.
Okay.
Because the quality of life issues will be different for younger kids and little bit slightly different for slightly older kids.
Sure. We do have another question. Are all the participants in South Australia or more broadly?
Yeah, they are from all over Australia.
Okay, wonderful.
The patients for the study, or we are recruiting the patients from the ANZRAC registry. It's an advanced, it's an Australian New Zealand registry of advanced glaucoma. So we have patients registered from all over Australia. So we have about 300 patients with childhood glaucoma, and most of the patients for the study are recruited from the ANZRAC registry.
Okay, great. And you were mentioning earlier also that obviously made more challenging with the COVID pandemic last year. So it's still great to see the amazing work progress. We do have another question from Jack, who's asking, how does childhood glaucoma differ to adult glaucoma in terms of the causes?
Again, you have different types of childhood glaucoma. One is called a primary congenital glaucoma, which starts at a much early age, which can be very symptomatic. So because of early increase in intraocular pressure, they can get an enlargement of the cornea, enlargement of the eyeball, and then they can present with watering, redness, and severe photophobia. Whereas if it develops at a little bit later stage, it might be a little bit asymptomatic compared to the ones that are developing. And mostly childhood glaucoma, how it's different to adult glaucoma is most of the time surgical intervention is a mainstay of management for childhood glaucoma, whereas for adult glaucomas, most of the time we start with medications, and if they don't respond to medications, then we go for laser and we go for surgery. So childhood glaucoma most of the time is managed with surgical intervention.
Right. And you were telling me earlier also that the earlier the intervention, the greater possibility of reducing the impact and stabilizing the disease to a degree to manage it.
Yeah.
Fantastic. We do have a question from Noella. She's asking, what would be the sample sizes necessary for each of the phases of the study you describe, especially from the rash analysis and for the reliability and validity of the studies?
Yeah. So for stage 1, if you're developing, if you've not had any previous studies, then it's, literature says it's good to have 10 focus groups. But then it's like, again, focus groups are the gold standard methods for qualitative study. And because we had the COVID restrictions, we were not able to do a focus group. So again, for qualitative study, the sample size is based on the thematic saturation. So we interview patients, and after say about 20-25, if the themes keep being repetitive, then we try to stop the data collection. So it's not based on number, but then it's actually based on the thematic saturation. So once you've reached the thematic saturation, then you conduct further few more interviews, and then you stop the interviews. And for stage 2, this is it's the sample size is based on a calculation, based on a standard error, and we have a calculation for that. And we have also done previous studies, and the sample size for this study is based on the previous studies and also the calculation. So more the patients, it's better, but then anything above 200, 300 will be always better, because for rash stabilization, for calibration, we need a minimum sample of about 200, but then if you have like 200, 300 or 400, then that will be better. But then it becomes really difficult to get such a large number of patients. So anywhere between 200 to 300 should be fine.
Right. And I've got the question that the $1,000,000 question that everyone always asks, that's come through about when might we get to see the general results from the interviews and the application of the research?
Yep, so we have finished for the adults, so it's like, and we have started analyzing. So I think within the next couple of months, I mean, obviously when we want to publish it, and that'll take time, but then in the coming months, in the next 2 years, the results of stage 1 will be out. Yeah, and stage 2, once we finish and once we analyze again, we'll be interested in publishing. So it'll be made available as soon as we finish that analysis and get the results.
Another question has come through asking around, do we refer children on to educational supports? Are they available?
For childhood glaucoma?
Yeah, what support's available?
I'm not really sure. Might be, I mean, the treating ophthalmologist or the clinicians might be able to give more information on that. Yeah.
No problem. Just from my perspective, thinking about the future now and just assuming the research progresses well, how do you see the application of the tool and the questionnaire actually, having a direct impact on individuals' lives? What does it really mean for the individual, and how might it change their experience that they have with childhood glaucoma in the future?
Yeah, for example, even if family carers, I mean, caregivers of patients with childhood glaucoma, if they are not coping well, then that affects the development of the child. So if parents are undergoing emotional stress, and then if you're able to identify that using the questionnaire, then you can provide additional emotional support, which then will improve the quality of care of the child. So it's, again, we are developing this quality of life instrument, and once this is developed, this will be it'll be implemented in the ophthalmic practice, which again, it's meant to improve the overall quality of both the individuals and the affected family members.
Wonderful. We've had another question come through from Jeremiah, who's asking, do you foresee the childhood glaucoma PROM being used as an outcome measure, surgical or pharmaceutical trials?
Yeah, again, once you have a disease-specific patient-reported outcome measure, it makes it very easy to compare the treatment modalities of different techniques. So yeah, so it'll be a very valuable tool to compare the effects of different treatment modalities from the patient perspective, because we are moving from clinician perspective to patient's perspective. So, and now many regulatory authorities, they require patient-reported outcome measures. It's becoming an essential outcome measure now. So yes, once you have a disease-specific instrument, so that can be used in clinical trials to compare the results of different treatment modalities.
We've just had actually a comment come through. In South Australia, children can be referred to the South Australian School for Vision Impaired for educational support. So thank you to, I think it's Asha, who has provided that to the people that are listening today. Thank you very much for that. It sounds like such a ripe area for research, where obviously more is required. What advice, Mallika, do you have for anyone that might be watching today and that might be considering a research career in ophthalmology?
Okay, so for ophthalmologists, like if you see, majority of the clinicians they are really interested in doing clinical trials and quantitative studies. So we don't have many clinicians looking into this aspect of the research. So it's mainly quantitative studies that most of the ophthalmologists are interested in, not in the qualitative studies. So yeah, so this is a very interesting area of research, and we want more and more ophthalmologists to focus in this research area, because then that can be translated into clinical practice to improve the quality of clinical care. Yeah.
Thank you. It's been a really wonderful and insightful discussion, and I'd really like to thank you, Mallika, for sharing your time and knowledge with all of us today. And I'd like also to thank just the audience for their participation, the questions, and the interest in the event. I think it's been a really incredible topic, and certainly as someone with a young family and children, I think this sort of area of research is so critical and important to help families and young children. Remember, you can watch this session again on the Flinders YouTube channel or the Flinders University Meet the Minds webpage, where you can also register to receive notifications of upcoming events. Our next event for Meet the Minds, the Lunchtime Lecture Series, is on the topic of politics of outer space. bringing today's space age issues back to Earth, which I think is going to be a very fascinating topic, and that one's with Associate Professor Rodrigo Pranio on the 17th of May at 12:30 p.m. So please make a note in your diary if talking about the politics of space is of interest to you. It certainly is to me. We certainly hope you can join us. But again, thank you very much for attending today. Thank you, Mallika, and have a good day, everybody.